Well, we're here at the Acadia Family Center in Southwest Harbor. Chris Popper, I'm joined by Dan Johnson, who is the executive director of the center. And Dan, if you would, just give us a little brief history of the Acadia Family Center. First of all, for anyone who doesn't know, we're located right next to the Causeway Club as you head into the into Southwest Harbor.
Right. We're on Fertile Point Road. The organization started as the MDI Drug and Alcohol Group almost 40 years ago. And then they realized they needed a treatment branch because that was more the education prevention branch. And they started the Acadia Family Center. For a long time, the organization was above the post office here in Southwest Harbor. And about 10 or 12 years ago, they purchased this property. Really nice site, beautiful setting across from the golf course, and a little more private, secluded. But originally we were doing mostly education, prevention work, and then we needed to do the treatment piece. Now that we've coalesced into one, we do all of that.
Okay, and it's not only drug and alcohol, but also people with mental health issues as well.
Yeah, we're duly licensed by the state to have a mental health license and a substance abuse license. So most of the people who come to us have what we call co-occurring disorders. That means they have a mental health disorder and a substance use disorder, but they can have one or the other. We see everyone that comes to us with any of those problems.
How do people get referred here to come see you and other counselors here?
Well, we're really well known. All of the local the primary care offices know who we are, and so they'll make a referral. Our catchment area is pretty much MDI and the outer islands, but we do have people coming down from Trenton, Lemoyne, Ellsworth. But people can also word of mouth, self-referrals. When we do an intake, we often ask that question, and we get a variety of answers.
You take main care, you take insurance, but you also don't turn anyone away.
Yeah, that's a key point, Chris, that we really treat everyone who comes to the door. We ask that they pay whatever they can pay if they don't have insurance. And sometimes that's as little as $5 a session. And the insurance companies will reimburse us at the rate they negotiate, which is not always the rate
Exactly.
of our costs. And so what ends up happening, our revenues pay for about 30% of our needs. And so the rest is philanthropy. We have a lot of generous people that we ask to help us, to support us. We have different events. The Hike and Bike for Mike, which is a lot of people know what that is. That's in the fall in September, is a fundraiser. But we also have a few other things during the year, and we just ask people to this is what we do. Can you find it in your heart to sort of help us out? And the people have been terrific, generous, because most families are impacted by mental health disorders or substance abuse disorders.
I've lived on islands before. Living on an island has inherent advantages and disadvantages.
Yeah.
One is the fact that everybody both an advantage and a disadvantage is that everybody knows everybody else's business.
Right.
And sometimes that's good, sometimes that's really bad.
Right. That's right.
But all of this is confidential. I mean, when I walked in here, the entrances and the exits are in totally different areas.
Right. Yeah, we actually even remodeled the building last year to provide a really isolated waiting room with a separate entrance because it's important that people feel comfortable coming, that it is a very private thing. We take that very seriously. And even though we live on this island with everyone else, and we run into people from time to time, we never acknowledge that we know them in any way. Unless they want to say hi, we'll say hi. But because many of us know that we have where we work, so it's a tricky thing, but we do a pretty good job of it.
We read about in the papers and on our website, and you hear it on the radio. There's a tremendous heroin problem, an opioid problem. It's tough down here on the island.
It is. I mean, I think it's amazing what a major epidemic it is. Before coming here, I worked at Acadia Hospital in Bangor, and for 4 years I ran the narcotics treatment program, which is a methadone program for treating opioid addiction. And so I knew that coming down here because I had a lot of clients
Yeah.
from this area. But since I've started working here, it's even more than I thought. And we work with a lot of folks on the outer islands. We have a lot of working class people. We have people who get injured. They have prescription opioids, and sometimes that becomes a problem. And if they can't get their prescription, then heroin has just filled that void. And it's a tremendous problem. So last year we started a Suboxone program, which is a medication-assisted treatment for opioid addiction, and that's been tremendous success. The problem we have is that the demand still exceeds what we can offer. So I'm going to be hiring more staff in the summer, and we're doing the best we can to keep up, but it is a tremendous challenge.
The other thing too is that being on a small island, there are limited things to do in the winter. Everybody has their favorite bottle, and sometimes that bottle becomes their best friend.
Yeah, alcohol is still the #1 substance that people seek treatment for, and it's something that we deal with every week. We have people wanting some help with that. The good news is that treatment works, and this is the message I keep trying to get out to people. Come and see us. Let us help you. I had someone in my extended family pass away from liver failure this week from a history of alcoholism. And it's like, so every family gets impacted. And if you would seek treatment and take that first step, it's amazing how people can build a recovery.
Well, and that's the other thing is that you're offering that program, so you don't, it's hard to change habits. And that's why by getting into a program such as here at Acadia Family Center, you've got that support to help you make those steps along the way. And sometimes they're not always steps in the right direction. Sometimes there are missteps.
There are. That's a good point, Chris. Relapse is a common factor that we recognize. We work really hard to accept people, and we're not into shaming people and accusing people of failing. It's like it's a chronic recurring disease, and if someone has diabetes and doesn't keep up on their diet, they're not going to be shamed. Well, people with addictions have similar challenges,
right.
And it's a recurring disorder, and it's a chronic disorder. So some people we've had have been in recovery for 20 years and can have a slip and a relapse. And so if they know they have a support there, if they have a resource, we want them to come to us as soon as possible so we can get them back on track.
Okay, this is a series of videos that we're going to start here at the at the Acadia Family Center. Tell us how people can get your phone number and website, so if they want to contact you, how do they contact you?
Sure. The phone number is 244-4012. We have our website is acadiafamilycenter.org, and we're also on Facebook. And those are great ways to contact us.
Don't post something, your problem on Facebook,
No.
Send a message or something,
Right.
something like that.
Exactly, but we are trying to use those mediums for education. We post things about addiction, about recovery, about mental health disorders, because we want people, the more people are informed, the better they'll be able to understand when they should come and see us and what we can do.
All right, so like Acadia Family Center on Facebook.
Right, exactly.
All right.